Radio.
You are listening to Whole Earth Radio.
My name is Rob Seaman, and you are listening to Whole Earth Radio. And today's episode is episode 10, a conversation with Dr. Decker Weiss about COVID-19 and other applications of natural medicine, talking in a careful and responsible and compassionate way. And I just want to introduce Dr. Decker. He is one of the, when you say integrative medicine, I think for a lot of people, he really comes to front of mind because of his work, being trained as a naturopathic physician, and then becoming a board certified cardiologist, kind of one of those leaps that not everyone is able to make, and pulling that all together. And he's the author of the Weiss Method, which is a great book on heart health. But today we're not here to talk about heart health, just addressing the giant specter in everyone's life right now, talking about COVID-19.
Yeah.
And Decker, thank you so much for being on.
Oh, always a pleasure. And I like the format. And I like that you added compassion in there, because we are sorely lacking it as we're going through it. It's either you're sick or you're not, it's fake or it's not, or whatever. We need to remember people are scared, and fear is going to, make our immune systems more vulnerable, and it makes us eat bad. It tends to force us into those bad habits, and, the COVID 10 to 19 pounds people are gaining and things like that. So I'm really encouraged that you added that piece in. As a physician, when I get to sit back and look at where our holes are, compassion is a big problem for us.
Yeah, thank you. Thank you for exemplifying that. And I think when wanted to start off giving people some perspective, because when I listened to the podcast you did with Dr. Neustadt back at the beginning of April, you were saying that you had at that time you estimated about 50 patients in your clinic in Arizona with COVID-19 or symptoms that were, if they had not been tested at that point, because that was early April, it was really hard to get a test. So how many patients would you estimate at this point that you have seen?
Well over 300. And I want to touch on that testing point. We have a lot of testing, but it's not great yet. It's okay. And that's nobody's fault. One of the weird things is there's a lot of them on the market. And so no test is perfect ever, but these really aren't perfect. The swabs that we do, the best ones that we have, can still have a 40% negative, rate, false negative rate, meaning you can have the illness, but it shows that you're negative. And then people infer, well, I'm okay, or I can't spread it. The only thing that these tests, whether it's antibody test or the swab test, can do is confirm that you have it, but it doesn't rule out that you don't have it. I'm sorry for the doctor lingo. We keep sounding more like lawyers every day.
It sounds like it's very hard to make a conclusive diagnosis.
These are little strands of RNA, and they take years. I mean, we don't really have, it took us years to get a good test for HIV and Ebola and Zika and H1N1. We're doing this at lightning speeds. We have a lot more effort on it, which is great. We have a lot of really brilliant minds around the world, but that doesn't speed the process a lot of times. And this virus is very, very slippery. It's very, very unique.
So I think that's a great kind of introduction. There's so much we could talk about, and we'll get to botanicals and some other things specifically, and as they relate to your clinical experience with everything. And just to give the broad disclaimer right up front, we are not offering, this is not a video about miracle cures for coronavirus or anything else, because we all know, if you've looked into it very much, that natural medicine is not about an overnight miracle cure. It's always about the basics and a broad picture of health, I think.
Yeah, I think that that's fair, but I do think we'll have to touch on the broad spectrum antiviral effects of a lot of these botanicals. And so whenever you're ready, let's make sure we touch on the difference between a cure and a broad spectrum effect, which natural medicine can give a very good broad spectrum effect. Cure is very, very hard. It's like hitting a missile on the tip of a missile head, versus just hitting it anywhere. It's very tough. And we really, things like hepatitis, C, we've been able to do that. But things like HIV, we've not been able to do that well. So I think that that'll be something worth discussing.
Yeah, and just to get right out front, to use that, the thing that I thought was worth getting right up front was, from your perspective, you've seen this, you've been on the front lines.
Yeah.
To some extent, you're risking your life every day being in clinic with folks who have tested positive. Obviously, you're a healthy person, but people who are feeling like they should minimize, or I hate to use judgmental terms, like say they're in denial about the severity of COVID-19. What would you say to someone who is totally discounting this as, it's no worse than the flu? Yeah, there's a spike, but death rates are going down. How would you counter the folks that say we shouldn't wear a mask, we shouldn't worry about that, and they minimize the danger of COVID?
Well, I think in medicine, when we're unbiased, we're not always unbiased, we're humans. What we do is we take the facts and we form opinions. I think for somebody who denies the COVID threat, or, never wear masks or all that stuff, I think what they're doing is they're taking opinions and they're trying to find facts to support those opinions. And that's going to really hurt you here. COVID-19 is very, very dangerous. And it's dangerous because you can have it and be absolutely asymptomatic, and you can walk by some seniors and you can cause a few of them to die. And we've never had things like this. Part of the challenge with COVID is it can be discreet. It can be, sometimes it's diarrhea, sometimes it's this. It's just a really slippery thing. So what I would ask is that don't form an opinion, look at facts, and then maybe do that. And if you do that, it'll just be a matter of time where you realize how bad COVID is. Meaning there's many more people in denial 3 months ago than there is now. And then eventually everyone's going to lose someone close to them, a mother, an aunt, a relative, because this isn't going away for a while. And when that happens, all of a sudden the denial goes away. It's a lot like smokers and cancer. Oh, I got to die sometime. They lose an aunt who's a smoker to lung cancer and they go, I'm done. And unfortunately, there's just going to be a population that does it. I also think that we're mixing in, kind of a civil rights, issue with, you don't have the right to close my business, and you don't have the right to do that. These are for politicians to argue, and lawmakers and things like that. Medically, there is no issue, though. Medically, it's, slowing and stopping the spread. Now, I do think that we were wrong in shutting everything down. South Korea is the example. They didn't shut anything down. They cut capacities by 75% of all of their buildings, stores, restaurants, shut down the big events, the rallies and the concerts and all that. And they masked and they sanitized very quickly and social distanced. And they were very, very good at that. And that country's been the most successful at slowing the spread. And so now they're having a little bit of spikes, so we're watching it. But for those listeners out there, if you want to watch what we're watching as doctors, we're watching South Korea. And we're seeing how to open, how to do it. But if we don't mask and distance, we're not in the game.
Well, and I think it came up on another podcast discussion that South Korea had the relative advantage of having had a MERS outbreak previously, right? They had some experience with how to react. Yeah,
and it's easier. They don't have a lot of blended cultures like we do. So they have a Korean culture, and that culture very high on the education end, very high on the science end. So it was a little easier for them to understand need and all that stuff. Here we're blended cultures. And we're a bunch of different people in a pot, and it's a strength, but it's right now a weakness. And I think that would be an additional piece, but it may not have worked. We'll see. I think one of the dangers we're seeing is that we're conflating, virus control and flattening the curve with always killing the economy. The real art is how to not kill the economy and do that. And, that takes really forward-thinking economists and epidemiologists and doctors and all that stuff to come together, because when unemployment rises, I think for every 1,000 persons that goes on unemployment, you lose like 10 due to depression and suicide. The numbers are staggering. So you always want to weigh those into the picture, and that's why South Korea is jumping out at us. And we're really seeing now a shift even in some of the staunch leadership in wearing masks and understanding social distancing, because it is associated with getting the economy back.
Yeah, and I think, to jump right into the natural approaches, I don't want to rehash the same conversation you had with Dr. Neustadt, but I think putting a link to it would be enough. But I want to bring up some of the things you said in there that I think just relate to your general practice of medicine. But talking about natural ways to reduce the length and the severity of infection by a virus, that how important that is, because when you look at the end of the spectrum of severity, that's death. So if we're saving someone's life because, they got an infection with, God forbid, coronavirus, but they had a less severe.
Right. And so in the absence of cure, which is really rare in medicine, because when we give an antibiotic, it tends to be as broad spectrum, like ciprofloxacin or azithromycin. And it brings down the number of cells and slows that replication, and your immune system does the rest. Okay, that's the way all of these things work. In the botanical world, and even things like the silver nanoparticle world, we have these broad spectrum antiviral effects. And no, these aren't cures. Let's be very clear. You can't hold up a bottle and go, this cures this, right? Otherwise, we would have cured HIV, right? And so that's the example. But what we've seen with COVID, what I've seen in my over 300 patients, is we decrease the severity and the duration. And when you look at vitamin C studies on influenza in the previous, or you look at silver particle studies on corona, but not this version of corona, it would be SARS-1, this is technically called SARS-2, or you look at MERS or some of those others, that's what they tended to do, bring down the severity and duration. What that does is, though, it saves lives, because the longer you're sick, the more you dehydrate, the more you get a chance to replicate up this stuff, the more vulnerable you become. The longer you're sick, the more you lay flat. That's bad for the lungs. And so then they tend to get more irritated, and they go on for that. But, when you look at it, even like simple minerals like zinc, and you look at, again, like the colloidal or more the nanoparticle silvers, nothing over 11 parts per million for me. You only take silver when you need it. You don't take it every day. I think people get a little crazy with it. Black elderberry, I think, is a great example. It's one of the few good tasting herbals that is also antiviral. Osha, St. John's wort, ligusticum, a whole bunch of them. And they tend to be very broad spectrum. Olive leaf extract, another one that, it has these wonderful properties. Does it work specifically for COVID? Well, all the ones that I've just mentioned, for me, to different degrees, in my opinion, but that's all that it is, it's my clinical opinion, have decreased the severity and duration. The longest my patients have gone truly symptomatic, there's sort of the big symptoms, and then the 2 weeks where you sleep more and you feel kind of fine and you can do a lot of stuff, but you're not feverish, you don't have any aches anymore. But the longest my patients have gone is 5 days. And that's severe heart failure patients, that's hypertensive patients. When you look at the lead drug, remdesivir, it's over $5,000 treatment protocol, which is highway robbery. That has, in severe cases, may be shortened 2 to 3 days. So I think the natural products, and those are more clinical. There's some data, but you're getting a lot of clinical opinions from ER docs too. So you see the antivirals that are coming in for this, very similar, shortened duration, severity. I think right now the natural products are far superior, though, and way more affordable, of course.
And, I know the Weill Center had put out an FAQ about COVID-19 and addressing when you talk elderberry, there was quite a kerfuffle on social media about the cytokine storm. Yeah. And they kind of made that distinction that if you're trying to prevent coronavirus or any, getting sick, taking elderberry as a preventive from the Weill Center recommendation was a good thing, but that if you were diagnosed with COVID, that you should not be taking it. Do you agree with that?
No, I don't. And I don't agree that it's a preventive. And I don't think Weill really ever understood that. I've heard Andy talk and met him a few times. black elderberry, you really don't want to start stimulating the immune system when you're not sick. You want immune system hovering low, spiking high, and coming back down. Think of babies and kids. Hum along, all of a sudden, big fever, and then it's like gone and they want to play again. And you're like, you were just like 104 minutes ago. So I don't like silver preventatively. I don't like black elderberry. I don't like any of these potential antivirals preventatively, unless we're dealing with depression or mood issues and risk. And we could talk about that, in a little bit. But I don't agree with that. Now, as far as the cytokine storm, it's like one of these things that you've heard of, but there's never been a recorded patient. I've never read a case history. I've never seen it. Now, understanding that black elderberry is one of the most prescribed natural products in the world. Italy, Germany, America. I mean, the amount of black elderberry that's been used over all of these years, and there's a theoretic cytokine storm is all that we're getting out of this. It is. I mean, if you look at the track record of black elderberry, I've never, ever seen a hospitalization, anything on that. Now, cytokine storm is a problem with COVID. But when you look in preventing cytokine storm, I think the best thing for that is curcumin. And I will use curcumin with every antiviral in COVID. And that's something I wasn't doing when I did Dr. Neustadt's because I didn't know it yet. And there's a couple things that are unique about curcumin. There is data, peer-reviewed data out on COVID-19 about how curcumin may help block that virus from getting into the angiotensin receptor in the lung. And this is the real vulnerable things, the lungs. There's a broad array of symptoms that we always have to watch. There's brain COVID now, there's intestinal COVID. I mean, it is, but the lungs tend to get us into trouble. We lose our oxygen capability and we're on to vent, right? I think one of the reasons I've been successful is I've used really higher doses of curcumin, always with my antivirals, because when virus gets out of control, you can get cytokine storm. Could there be a mechanism in any botanical or even with the silver nanoparticles that could enhance that? Sure, possibly. But when we looked at, for example, dexamethasone, a steroid for patients trying to keep them off vents or getting them off vents, dexamethasone suppresses the immune system, but is a very good anti-inflammatory, and it's really working. It's very hard for a naturopath to get excited about a steroid, but man, it's working. It's low cost. We don't have to grovel to the pharmaceutical company that has remdesivir. We've got a great tool. It's readily available and it's working. And we're shutting down that inflammatory pathways into the lungs and the body. There's a risk, of course, always when you're using steroids, but it's working better than we thought. What I do with my patients is I get some of that effect, but curcumin, remember, will enhance and balance the immune system. I don't have to worry about it. It doesn't have such a dramatic anti-inflammatory effect, but it doesn't give you the negatives either. And I start that and I pair that, and I encourage anybody, when you're looking at your preventative, you look at curcumin, I think you look at vitamin A, and you look at vitamin D3. I think those three things, especially the D, it is amazing, Rob, that I will look at my Medscape, all my straight conventional feeds all day long. Not 4 or 5 days goes by that are we missing out on vitamin D as the low-hanging fruit to prevent COVID. And these are all conventional journals. And so when I look at that, so I know I wandered on too much coffee this morning.
No, and you mentioned vitamin C earlier. I mean, I think with natural medicine, I'm always reminded, like I said, the back to basics. I think I really appreciate your sharing the specifics about the botanicals and using the curcumin with because I don't think that's something that folks who have not had your clinical experience, like you said, you weren't necessarily doing that 2 months ago.
Mm-hmm.
So you're adapting to how you treat this as you see the disease picture in your clients and how you're addressing that, which is so valuable to them. First and foremost, they're lucky to have you as a doctor, but we're happy to be able to share these ideas. And it's one of those great things about natural medicine is that it's something people can just apply in their life, and that it's empowering, because I think the fear of COVID while we were talking about wanting people to be aware and to take it seriously, and we can talk about social distancing and masks and respirators, but the fear that is necessary to motivate people to action can also be debilitating. So it's that fine balance where how do you get somebody to be aware and proactive, but not just paralyzed by the fear that they can't do anything ever, even with social distancing, they should just not do anything, and just shut down. And that has, I think, such a debility. It can lead to that depression and certainly anxiety.
Yeah, you talk about disempowerment, and it's a very big part of all of this. Cardiology, I literally had two types of attendings when I was in training. The ones who completely disempowered a patient. You take a statin, when you have a clogged artery, we'll stent it. If it's bad enough, we bypass. It's in your genes. You can eat better if you want to, whatever. I mean, it was drilled into them over and over and over. And I would just gag, but I was a student and it was. And the other ones that would empower it and say, this is a preventable disease. Our system isn't very good at that yet. We want to be here for you. We want to use the best of science and things. But when you exercise and when you eat better and all that stuff, that all matters. And it was very few that were empowering and the most were disempowering. Even to this day, you'll look at a patient, I'll have patients come in and they say, I'm going to die any day if I don't have bypass surgery. I'm like, okay, all right, let's talk about how many years it took, 30, 40 years for this coronary artery disease to develop. Now you're having chest pain. And then I'll literally hold up a book, Reversing Heart Disease for Dummies. And I go, okay, that means even I can do it. Okay. And so, and it is, and it's about empowerment. It is. And in COVID, people think it's going to land on them, and, it's up to God whether they're going to take them at that time. And maybe they're right, maybe they're wrong, but maybe that same God gave us the power to defend ourselves.
Amen. I mean, I think, not to go on a tangent, but the phrase, the saying, the Lord helps those who help themselves. I mean, you gotta take advantage of what we know to be beneficial. And some of those things you were talking about is getting enough sleep, drinking enough water. And that's when I think of natural medicine. People it's not always the latest thing that you buy. Sometimes it's what you don't do. And Dr. Neustadt talking about, you and Dr. Neustadt talking about creating a picture of health with lowering sugar intake, things that set you up to be healthier. Basics, hydrating, enough sleep, not intaking a bunch of sugar and chemicals, and then adding in botanicals and a good diet and a good outlook on life. And man, before you know it, you got a healthy person there, but that's not how people come to you.
Yeah. And that whole term alternative medicine to me is what comes to mind when you say that. This herb was from the Himalayas and the Dalai Lama personally blessed it and everybody should take it. And those things have always kind of been in natural medicine. They are. They're fads and all that stuff. What's not sexy is really, really good sleep. And, the amino acid therapies, the use of the 5-HTPs and the GABA analogs and the pharmagabas and the taurines and all of these things, natural medicine has leapt ahead of conventional medicine in good quality sleep ability. We struggled with it because the botanicals generally work, whether it's passion flower or whatever, to sleep, either by trying to kind of knock you out a little bit like valerian, or it would try and bring down inflammation, hoping those neurotransmitters would restore. Well, now we can give these just simple amino acids and we're doing better than ever. And if you don't sleep, you don't tend to recover from anything, especially a virus. And so I think that's very important. In water, one of the things when you see listed on antibiotic bottles and even antivirals is none of them work unless you're properly hydrated. Don't be afraid to call your local doctor and say, I'm sick. I think I just need an IV. I will give saline and lactated ringers, which is just replacing your electrolytes, IVs all the time to people with flu and colds and all of that. And then they start to jump on top of it. Their immune system can kick in. But those are those fundamentals. Vitamin C, it's not sexy. It's been around forever. We all know the Linus Pauling stories. But it decreases severity and duration of many viruses about a half to a third. And that's really good. It's an antioxidant. It's everywhere. You can buy them at gas stations. It's everywhere. Yeah. I don't suggest that, but yeah.
Right. Don't buy your vitamin C at a gas station, folks. Buy it at your local independent health food store.
That's right.
And but continuing on that botanical, I like you said, I don't want to get too deep into the mechanisms of stress and disease process and the HPA axis, but talking broadly about adaptogens. And I was looking at the restorative medicine treatment for viral syndromes webinar that you did, and you spent a good amount of time on, let's say, some adaptogens and kind of nervines that were possibly also immunosupportive. And then you talked about some of the, we don't have to get into the pathways and mechanisms of action, but just generally, I mean, how do you feel like adaptogens fit into this picture?
Well, first, for anybody listening or watching, the term adaptogen is something that is really strictly a botanical term. Like, we'll have things that are antipyretics. They lower fever in the botanical world. And then in the drug world, we have antipyretics like aspirin and ibuprofen, not really aspirin, but more ibuprofen. So adaptogen is a uniquely botanical word. And what it means is that the plant's behavior will change what it does on your system depending on what you need. Boom, right? Rhodiola, you take it in the morning, can help you get energy and wake up and be fresher and clearer. And if you can't sleep at night, it literally will adapt and it will help you sleep. And it's a whole category. And the neat thing about adaptogens is they're throughout all of medicine. In India, you'll have ashwagandhas and the one that starts with an S, and I always forget it. I don't know right now.
Shatavari?
You have the better names for them. I'll think of it. But in India, in Ayurveda, in Chinese medicine, you have all your ginsengs. You have your Erythrococcus, and you have your Siberian, and that's the Siberian, but you have your Korean ginsengs, and your Japanese ginsengs, and your Chinese ginsengs. And all of those you have things like olive leaf and stuff. And a lot of that, and there's even arguments that ginger has a lot of adaptogenic properties. Licorice is probably the more famous one, not the little Swizzlers you get in the plastic bags.
Not the candy.
Not the candy, but licorice is. Now, most of these that I have listed, if not all, have peer-reviewed data that show that they also have antiviral and immune support activity. So we've always wondered, why do depressed people get more sick? And when they're sick, it lasts longer, it's more severe. And of course, a lot of doctors just said, well, they're just dragging on. And it's not true. Until we validate people's illnesses, we're never going to get anywhere. That's that compassion piece.
Right on.
It is. But when you look at olive leaf and you look at rhodiola and you look at ashwagandha and you look at these types of botanicals, you will see that they will modify our inflammatory systems to help improve our mood. Again, mood issues, anxiety, depression, all of these things, they are inflammatory conditions, including insomnia for that matter. That's why these adaptogens they can help you with fatigue, but they can also help you with depression. And they can help you with all of these things. And that's why you see dozens and dozens of formulas out there. But the unique thing in the time of COVID is it is a perfect tool that if you are somebody battling those low moods, especially if you're like, I was always happy because I got to hike, or I was outside every day, or I was in an office full of people and that was my social life. I'd get home, I'd pop my feet down, but now I don't have that anymore. When you're feeling those moods, you are vulnerable, and you look at things that affect what we call the hypothalamic pituitary axis, but there are these botanicals that will help mood and help energy, but they have that nature. It's like nature thought about it in advance. You may need some antiviral support as well.
Well, I have a question for you along those lines, because we're throwing out a lot of good, there's so many good formulas, like you said, out there, and companies that people have grown to trust. You are in clinical practice, and when people come to see you at your clinic in Arizona, they get, I assume, a pretty detailed, you give them like a natural script or whatever kind of script it is. So they get your specific recommendation.
Right.
For someone who does not have the benefit of being able to come see you, that's living in, maybe a place where there aren't many integrative or
Sure.
naturopathic or anything. How do you recommend that someone like that start with selecting a good formula? Or
Yeah, it is hard because every day there's some company that pops up on your thing. It's like you type in, mood issue, and all of a sudden you've got 8,000, products being slammed at you and done. And, it's that difference between information and knowledge. Like there's so much information, but what's that one little bit of knowledge that helps me? One of the things I think you brought it up earlier, really finding a good local health food store. Yeah, I mean, good local health food stores don't have a ton of brands, and they don't have the cheapest brands always. They will have things that work because they basically become primary care for the local community. And I know that people in health food stores aren't allowed to diagnose and treat, but they're doing it, and they're doing a pretty damn good job of it in a lot of cases, in my opinion. Meaning I've never seen somebody working in a health food store get somebody hooked on opiates. But I've seen them recommend CBD and curcumins and icing and send them to a PT person, and now they were able to stay off of it. Maybe they don't have the strength of doctors, of course, and the knowledge of everything, but they also haven't screwed anybody up. And so don't underestimate the power of a good local health food store. And really, one of the unfair things, the truly unfair things about natural medicine is you have to know more about the company than you do about the actual supplement you're purchasing. And it's just inherently unfair. You'll have these really bad companies, they'll have these beautiful websites and packaging, and you just don't know. And I think the more you can investigate, I think, if anybody wants to reach out to me, I'll give my office number. I give 15-minute free consults anytime to anybody. You want to talk to me for 15 minutes, you want me to tell you what brands I like or something, I'm glad to do that, because we need to separate out the wheat from the chaff here. The good brands have to step up now.
That's great, and we will definitely put that information and a lot more information in the show description, so folks should be sure to look at that and to get that and to kind of take this hopefully to the next level for them. And one thing I just wanted to reflect on, you talk about the health food store, it's where I've been spending a lot of time my entire adult life, and Deshay is often looked at as like this disadvantage, this wall. And I just think about, there's a guy who went on to become a naturopath here in Illinois, a guy named Thor, was, working in a health food store.
Yeah. You don't bump into a lot of Thors.
I know, right? I say
which Thor? Which Thor is that? Well, there's the superhero and then the doctor. Yeah.
Thor, and he said, I love this phrase, but he said he wanted to put the E in Deshay, because Deshay, for those who don't get this, the Dietary Supplement Health Education Act of 1994 limited what you can say in a health food store. As Decker pointed out, folks, they don't always follow that. And the final ruling of 2000, I should say, made some important distinction. I mean, my point being, there are a lot of things you can say within that. And I watch stores do this dance. You've seen it, they're talking about supporting the structure and function of your immune system. And they're not talking to you about COVID-19. But I think the good news is that that's all true. And that really is, to me, like a natural philosophy. We are supporting the structure. We always want to support your core functions and homeostasis and the health of the whole person. And so it's true. It keeps us a little constrained.
Deshay's done a lot of interesting things. It also protected our industry. We had a lot of politicians ready to put the kibosh on the whole thing. And then it would have driven it underground until it came back up again, because natural medicine will always, and plant-based medicine, will always be the basis for prevention. Meaning you will not get every time conventional medicine gets into prevention, it stumbles. You may like statins as a cardiologist, but you'll always increase risk of depression and heart failure, diabetes, and cancer. There's always that risk. You're going to trade. You don't see those things. So natural medicine will always be there. So in a way, it protected it, but also it really, what I called it, it enhanced the silos. So, Rob, you've been in this world a long time in this field. Not you're an old man, but meaning in this field. When you talk to a doctor, when you talk to a doctor or person, it seems like they're either open-minded or have a positive experience in natural medicine, or they're completely closed off. It created these silos. Conventional medicine, like in my field of cardiology, I can't get anybody to test, in conventional world, with even a homocysteine, a basic thing of methylation, one of the leading risk factors for heart disease, homocysteine. But there's no pharmaceutical. That means it doesn't exist. And I'm talking about good people, not bad people.
Yeah.
Good people.
It's a bad paradigm, or a bad
It's
application of a potentially useful paradigm.
And when you look at, like when I was talking about curcumin and the data on protecting the lungs, and by the way, Eleutherococcus, nice paper just came out on that, the ginseng, about protecting these lungs, things that we normally wouldn't associate curcumin with, but have good data published in peer-reviewed journals, that we're getting. Why wouldn't every doctor jump on that? It's in spice cabinets everywhere. This is ubiquitous. We have better and better ways of getting it into the bloodstream. It was always harder to get it into the bloodstream. Remember, Rob, everybody's teeth turned yellow early on and all that craziness. So we've gotten all past that. We've gotten better at it. But it's the silos. And the silos right now are really hurting people. And, why is it? I'm not that good a doctor, Rob, and I've had nobody up on a ventilator, and I've had nobody die. Now, when I treat enough people, somebody is, okay? I'm going to lose somebody when I get enough. But my patients, again, are very sick. They're hypertensives, they're heart failure patients, they're the patients that tend to die when they get the flus or pneumonias. And I haven't even needed to hospitalize any of them. And some of them I've had to come in, and I've been doing silver ion breathing treatments and some really innovative stuff like that to try and bring down that replication in the lungs. But it's working. And those silos, I don't want to put us versus them as far as the initials, because Rob, we know MDs that do nothing but juice fast now, and we know naturopaths that do nothing but shoot Botox. So let's forget about the initials and look at the person themselves is what they're doing, and how they exist in those silos. I find people too much in the natural medicine silo. Like I'll have a patient come in and they'll be in terrible pain, and I'll be like, look, you have an SA joint out. I'm going to put you on some natural stuff, but I'm going to give you a short blast of a steroid, and then go and as soon as the inflammation's out, we're going to have somebody adjust that hip and get it back into place. It really works well. It's a one short-term thing. The zealots, it doesn't work. And you're always talking about bringing people into balance. That's exactly right. We're all going to need conventional medicine a few times in our life. What we want to do is get in there, get the appendix out, or set the bone, tie the ligament, maybe clean the carotid, and then get out. You mentioned integrative medicine, Rob. My patients don't want integrative medicine. They want outegrative. They want out. And integrative is a nice term. It is. It's about everybody getting on the same page for the patient. But the reality is patients go, I don't want any meds. I don't want to be on meds and herbs. I don't even want to be on meds and supplements. I want to be off everything. And I tell them, let's get to the best place possible, but let's get you quality, quantity of life. Let's look at it from those aspects. A lot of my patients need diuretics. Natural antihypertensives are very good with the top number, not as good with the bottom. Bottom takes detoxing, getting the estrogens out of the body and all that kind of stuff. So, it's just all about that kind of stuff. And thanks for letting me go on my little diatribe about it.
No, it's really valuable information. I appreciate all your insights. And I think that, there's no agenda here. I mean, the thing that I thought about was when you talk about, it sounds like more than the term integrative. I think of that historical term eclectic, and the eclectic physicians were basically loyal to whatever worked, right? It was botanical.
In the Ellingwood, yeah.
A newly isolated alkaloid, back in the day, they just whatever worked for boric acid, if that was what worked.
Yeah.
What's natural is not just necessarily in a little box, and it's not just about what's natural. It's about what works for the patient, and that.
Yeah, it is, and that's where we'll need to get to, and that's when it'll be kind of what I call medicine without built-in prejudice. We have naturopaths that don't want to ever use a pharmaceutical. We have MDs that still think that thyroid labs really diagnose thyroid conditions when it's really temperatures and things, and the data's been out there. Dennis Wilson's done marvelous work with it, and all of these people. But when you look at COVID, let's take a quick minute and talk about a patient with COVID goes to see their medical doctor. Okay, and it's a good medical doctor, wants the best for their patients, but they're siloed. They'll say, okay, drink water, and if your fever goes, now they're even starting to let fever run. It's radical purpose, but the body's best natural mechanism to get rid of virus, fever. But they'll say if it, let's say it's somebody who is following conventional medicine, it has changed a little bit. Fauci has been pretty clear, let fever run, don't do that. But they'll say, drink fluids, sleep, and take that ibuprofen if you need for fever, and if it gets bad enough, call 911. Now, we've been talking about empowerment. That's not empowerment. That is not empowerment. That's basically saying, it's kind of in the wind. We don't know how bad it's going to get with you, but if you do those things, you might be able to help it. Now you go see a naturopath or a holistic practitioner. You walk into a really good health food store, and let's say they give you, hey, I saw this podcast with Dr. Weiss and Rob Seaman, and we are going to give you this curcumin because there's a paper on it that shows it may help protect the lungs, and we're going to give you what we think are good broad-spectrum antivirals, 4 or 5 times a day because we need to do them frequently. So, again, I tend to like the 11 parts per million nanosilvers, sometimes they're mixed a little with elderberry, but those nanosilvers, but there's plenty, there is. And so we're going to do that. Here's your vitamin C, and here's your vitamin D and A because we want to get those levels up. And here's how we're going to take them. And you go, and now they're feeling empowered. Like, I got things I could do. And does that add some placebo effect? Of course. I don't deny placebo effect. In fact, if I could only get placebo effect on all of my patients, I'd be the most brilliant doctor in the world. But this is more than that because we're using peer-reviewed literature. Curcumin itself has 6,000 peer-reviewed studies, more than any pharmaceutical ever. Now that person's empowered. They have things they can do. They're using peer-reviewed literature, and the best that we have on their COVID-19, we don't know if it's going to work because those were studied on things other than COVID-19. We're hoping it crosses over to that, other than that curcumin study that I read. But, we're hoping it crosses over, like when Zika, when H1N went over, and Ebola's. We hoped that those natural things that worked for other viruses work for it. But they're empowered. They're working on keeping that inflammation down with the curcumins. They've got their natural products, but they've also been reinforced with good sleep, good water, all of that kind of stuff. Those are 2 very divergent paths, Rob. Very divergent. And they don't have to be opposing. They are siloed because of us, of doctors, not because of you folks. Patients generally want what works. That's what they do. They want the best research to do that. Well, we had the hydroxychloroquine nightmare for a while, which was one of the worst.
Literally, right? It gives you nightmares.
Well, it was the one thing the cardiologists agree on about COVID was, could you have picked a worse choice? Because we deal with the arrhythmias from what we're like, even if it works, how many people are going to die from arrhythmias? So we're finally past that. And now we're getting into these things. But these silos are really important for people to recognize.
Well, and I love your approach because even though I'm totally a naturalist and I try to be open-minded, and you talk about, I can picture 2 silos here, just totally separated and segregated. And I think the problem, I like to say, pharmaceutical medicine is arguably more likely to have side effects with their remedies. Natural medicine is more likely to have side benefits. If you're taking vitamin A for immune health, you're also getting benefits all over the body. I mean, it's just the way nutrition works versus, pharmaceutical allopathy.
And I think that's very fair. And it's something that a lot of medical doctors don't understand. Well, if it's therapeutic, it has to have downsides. Probably eventually, if you got to high enough levels of curcumin or high enough of licorice or high enough, there. But in general, it just doesn't have that. And they don't understand because something that works, positive will always have a negative. And I think that that's something that education, and that's where Weil's done a good job, with educating medical doctors and things like that going, there are positive side effects, that exist. They're generally just in the botanical world.
Yeah, no, that's so good. And I think we could you can get into diet. I know in your book and so many other places you're talking about that and the big picture, but staying kind of on COVID, because I do think there's so much bad or mediocre, half true information out there. But Decker, I know we were talking a little bit about ventilators and in hospitals where they've been using ventilators for COVID patients. I've read some things that alluded to a correlation of higher death rates on patients that were put on ventilators. Do you have any insights on that, or do you feel that that data is accurate?
It's probably accurate, but it's not fair, right? One of those things. No doctor ever wants to put a patient on a ventilator because the ventilators take over breathing, and then the brain doesn't have to initiate the breathing cycle. We have something called a respiratory generator in our brainstem. And when that is having problems due to virus, infection, drugs, overdoses, that thing tends to slow down and we can't saturate our bodies. We die. We'll have a heart attack. We'll seize, whatever. So no doctor is ever excited about putting on somebody on a ventilator because we know their risk of passing away just, jumped. Okay. Now, what we've learned with COVID is we were scared because it was an infection to use things like steroids to try and bring the inflammation down to get the oxygen up early. So we ran a lot of studies, and found out that when they're starting to get to those bad saturations, it is actually okay to use dexamethasone, for example, in order to clear their lungs a little bit so their breathing's better. And, that was a big step because, ER docs, ventilating, putting somebody on a ventilator is a fairly simple process, and you immediately see they're out of trouble, but their long-term risk is there. And that's where dexamethasone has really helped. When we talked about our silos earlier, both of those silos can end up with somebody losing their oxygen saturation and needing to be in the hospital. So we're getting better at that. And what you're seeing is not as many people are dying from COVID. And the reason is we're holding back on the ventilators a little bit, using those steroids a little earlier, and people are recovering better. And that's a big breakthrough. It doesn't sound super exciting like a vaccine or anything, but we're talking about significantly fewer people dying. And it's really, you're seeing it nationwide. You're seeing all these people in hospitals, but you're not seeing the death tolls go up. So good for us.
Yeah, and I don't want to get, it's such a polarizing issue. You said vaccines. I was talking to someone the other day about oral polio vaccine as this interesting, maybe having more broad applications than just preventing polio. And it's so interesting, I think, to me, because I am not for or against, like anything, I would be for the most responsible, cleanest, greenest form of whatever we're talking about. If we can improve vaccine therapy, we would be foolish not to. And it kind of, as you were alluding to, mainstream medicine not always being progressive, they just kind of use what's given to them. They don't ask about preservatives and some of the questions.
So here's my take on vaccines. First of all, we had some really early success. And I see like anti-vaxx people who bring up great points, because the pharmaceutical industry has not been transparent. They're still using mercury. There'll be fetal proteins. It's fetus proteins that they'll have in there. I mean, literally there's no conscience at all to that industry. And so they deserve criticism for that, significant. And also kids that have had terrible side effects. And, the question about vaccines and autism, and it's still a very big question. Some people feel absolutely confirmed, that autism rate keeps going up every time we add vaccines. There's part of that. There's something probably there. So the pharmaceutical industry isn't helping themselves. They had some really early successes. Tetanus was an amazing success, and polio, amazing success, live dead virus, all that stuff. Then it started to get harder. We thought, hey, virus, vaccine. Last year's flu, we'll just give you this year's flu or give it again. So if it covers it, it automatically will, and we're not seeing any downsides. And then we started building them up, the business of it, hepatitis B and all these things, influenza, like rotavirus vaccine. It's a 24 to 48 hour diarrhea. That's it. The vaccine doesn't seem to work super well. So is that something our kids should have? So then the business of it got crazier and crazier. And now what you have is and earned negative reputation from the vaccine industry. They've earned their negative reputation. They've earned it from not being clear, by not being forthcoming, and also using some pretty barbarian tactics in order to shove laws through and things like that that can do it. At the end of the day, vaccines, every single one of them is a different medicine. And every single one of them does not need to be judged as a whole, but as an individual. I'm very open to a COVID vaccine, but they're very hard, as these viruses have gotten more tricky, we don't have one for HIV, right? We don't have ones, even some of the other ones like chickenpox isn't that great. People could still get shingles from it. So how do you, in a short amount of time, prove that it's actually going to work? It's a really, really tough call. I will watch and pay attention to it. I am very nervous that we're going to release something just to release something. Hey, you're vaccinated, you can go back to work now, it doesn't matter. People are getting COVID twice, so they're getting immunity. We see their immunoglobulins up, we see IgGs up, and then later they're getting it a second time. That factors into vaccine production. We have over 12 mutations of this virus. It's going to be tricky, Rob.
Well, I wanted to circle back in light of that to something you said at the beginning about the testing you were doing on your patients and doing antibody testing. Is the antibody testing getting any better than just the regular testing?
It is. So antibodies, it's kind of let me give you immunology 101 sort of, okay? Because immunology is so complex that I need to simplify it. So you have what's called your innate immune system, Rob. That's like everything from skin and stomach acid that protects you. And that's those white cells, those lymphocytes and eosinophils and basophils. We're running a white count, right? That's your immediate response. Then later on, you have your acquired response. And that is your B cells. B stands for bone marrow. T cells, they come from thymus glands. So we actually did one thing simply, B for bone and T for thymus. And those things, messenger out and they go bump into virus and they make these antibodies. And there's multiple antibodies for one virus. That's what it is. The more different antibodies, probably the better shot you got of knocking down. Now that's called the acquired immune system. So the innate is that beginning and lymphocytes and things. And then later on, you have your acquired. That acquired has two flavors. When I teach it, I teach vanilla and chocolate. Everybody wants the chocolate. But the first one you get is vanilla. It's called the IgM. That's the first memory and antibodies you can read. And some of them will look at the spike protein in the COVID. Some of it will look at part of the capsule. Some will be part of the RNA protein. Different things, different antibodies that it will be. And then after that, you get to the chocolate, what you really want, which is the IgG. And that is good going. That means you have the best shot at having immunity. And that's also what we ask people to donate their blood, and we take out of their plasma is that IgG. That's that gold that we want. So the more antibodies you can test for, the better the diagnosis. So yesterday I did a finger stick, and it was one antibody that they checked, IgG, IgM. There's another company that has 6 antibodies, and it's a blood draw. So it's not as easy to do. It's a blood draw. So you're going to see 8 antibody tests, 10 antibody tests, 12. And they should always test that IgM or the vanilla and then also the chocolate, the IgG. So the more antibodies, the better. And we're really making nice progress on it. More in the private lab side, unfortunately, which is what we have to pay cash, than the public lab side. But we're making good progress in antibody testing.
Well, yeah, that's good information for folks to have. But is there now some question as to how long that may remain relevant to the person? Like if I test positive for antibodies, as you were alluding to, getting reinfected, does having antibodies mean that I won't get reinfected? And if for what length of time does it offer any protection?
Aren't those great questions? We don't know. We don't know. There's probably some people at the CDC that are really looking to crunch data that are getting some ideas. What we get is stuff that comes out of the journals. I get a daily to every other day report from the state of Arizona on what they're getting, because I'm on the governor's list to when we need field hospitals, or if we need field hospitals, I'll be participating in that. So I get access to that, but we don't know. I want to go quickly to the swab testing and talk about that. So this is where you swab the throat or you go up the nose, and unfortunately that's the way I do it. You can really gag on that thing. There's a lot of false negatives with the actual testing. So if I've confused you listeners and viewers, let me do this. When you think you're sick, you do the swab. That's looking for the specific RNA itself to see if you have an infection now. The antibodies are that secondary system you're looking for protection and maybe to see if you had it in the past. But the swab is like, do I have it right now? We think there's up to 40% false negatives. And this isn't a conspiracy. This isn't anybody's fault. It just is what it is. We aren't that good at it yet. It came out so fast. But if you have symptoms and your swab test is negative, don't believe it. And if your physician says you're fine, your swab is negative, then they haven't really looked at the data. That's unfortunate. That's not natural. That's not siloed. That's just somebody who doesn't understand the data. If you have the symptoms in my book, most likely you have it. We're not in flu season. This isn't a flu season. We're in the summer. If you're having these types of symptoms, what else is it likely to be? Now, we think there may be a local spike of H1N1. We don't know. That's just creeping out, that may be coming in with it or not. We'll see. But in a non-flu season time, you assume that that's what you have, and even regardless of the test.
Yeah, there are a lot of unknowns here, and it's, true to your nature and character to just be totally candid. I think a lot of times folks want to be able to give a definitive answer, but I really appreciate your total transparency.
Just remember, this is new. So this strand of RNA, whether it's synthetic or it came from a wet market, I sure don't know. There's a ton of suspicion. Either it's bad sanitation or it's, developed in a lab. Either way, there needs to be accountability. And I'm not talking about us attacking China. I'm talking about, the World Health Organizations, international courts getting together, really doing an investigation. Otherwise, it's going to happen again, right? But it's new. We have literally a new piece of genetic code that has never been on the planet before that is jumping into our existing code, largely through these angiotensin receptors in the lungs. And it takes years to figure out how it's going to behave. And the other piece of that, Rob, is people will be like, well, I don't understand this flattening the curve thing. All right. So it's really very simple. Everybody's going to get the virus. Think of chickenpox, measles. Okay. We have we think 12% of the United States that either has antibodies or may be protected. That's about it. So 88% to go. That's a lot. If we all, scary thoughts, right? And it is, but it's reality. If everybody gets it at once, the system crashes. Meaning I'm in clinic, 2 to 3 days a week. I'll see 17, 20 patients a day, half of them COVID. I'm going to probably have to add a day soon in order to keep up with it, because we have to clean the rooms and there's a process when you see COVID patients. It's a different part of our clinical setting. And so, but everybody's going to have to get it. Now, the vaccine people have a great argument. Let's have everybody get it in a controlled way through vaccine. And that sounds really, really good, right? If we can get over 70% of it to get one little shot and they barely have any symptoms and there's not side effects and you get immunity, that's the miracle here. And I hope that happens.
So despite having some misgivings about the vaccine industry in general, and you said every medicine should be evaluated individually, it sounds like you're saying COVID-19 in your mind a really good candidate for a vaccine because of that novel.
Not because of that. I'm sorry. I probably misled you, because I'm hopeful. I don't want the other 88% of our country and maybe 90% of the world to get it. We'll lose thousands.
So it's not it's not because it is so such a good candidate. It's because it is such a devastating potentially disease.
Yeah, yeah, right. It's because I'm really, really hoping that we're able to do this with a vaccine. And also, I mean, we've never as a country got our scientific community so focused. I mean, we have some of the greatest labs in the world. Vaccines are not developed by the top scientists in the world on that. They're developed generally in labs and business models, and they're trying to figure out whether there's a market for it, insurance coverage, that this is different. This is like when we geared up for World War II. We have great minds, brilliant minds that we've spent our tax dollars through student loans and education for years. It was like Apollo 13. This is what they paid us for. When there's a problem, getting them back home. Well, this is the scientific community. This is what we invested in. We have our best minds. I want to be optimistic and go, I think mankind, that when we really put our noses to the grindstone, we could do it. But I don't have any evidence of that.
Thank you for interpreting that, because I think you're being completely realistic. It sounds like not optimistic or pessimistic. You're maintaining that true open mind.
We both. We don't have even, we haven't been able to get a vaccine for things like HIV, for example.
Right.
So it's probably impossible.
To have a vaccine for COVID, like HIV.
Is it going to fall into that? Because we can, look, it's easy. You make a vaccine, monkeys don't get it. And now you start to put it into the public. And sometimes you see devastating side effects. So then it stops it. Or you'll see that it didn't work. People got the vaccine, or that they got COVID from the vaccine, depending on what you're using and all that stuff. So there's so many variables. And then you have an earned distrust. It is an earned distrust. People who are anti-vaxxers, look, I think every one of them needs to be looked at medicine individually. There's a very big difference than from the meningitis vaccine versus like the Hep B vaccine or all that stuff. So they need to be looked at very, very individually. But the pharmaceutical industry has created an environment of distrust. And that distrust could really hurt if it's a good vaccine. It could hurt people from taking it. And religious organizations do have the right to restrict its use. I believe that they should have that right.
Sure.
But would they, but what's behind that right? The distrust. They're like, look, we're protecting our parishioners. Yeah.
Well, and the amount of bad information on this subject, and I try to be intellectually honest and keep an open mind, and I really appreciate your perspective. It helps folks balance things. One might take away, maybe there's some good vaccines and some bad vaccines. That would kind of mirror the way that life runs, right? It's not a binary world, but I do see a lot of bad information on the anti-vaxxer side, and just some complete nonsense science and distortions of facts. And when those are presented in a certain way, I find that very disconcerting. And I hate to see people being manipulated rather than just, let's have a conversation. Let's give people information. You can form your own opinions. But when people are proselytizing about medicine, and it's people that don't practice medicine, that's why I think it's so valuable to have your insights and your perspective for a broader swath of the population, because there's so many armchair experts and armchair revolutionaries at this point that are just ready to paint with a broad brush. And I think people get well with much narrower strokes than this is all bad, this is all good.
Right. And let's look at the vaccine industry, one additional thing. There has to be some individualization, right? So for example, premature baby that comes out, let's say it's 6.5 months. That baby's only been in conception for 6.5 months. You're telling me that's the same thing as vaccinating a 9-month healthy baby at proper weight? Also vaccination in the time of autism, that changes it. Is it a cause? Is it a factor? Is it that? Well, but as a doctor, you have to look at the atmosphere. Like, there's certain pharmaceuticals that I stay away from now because I think they can add to risk of acquiring COVID and having serious cases of COVID. So my cardiovascular, therapies have changed because I'm now in an atmosphere of COVID. Now, the same thing with vaccines. You have autism and we can't get our handle on it. The vaccines are at least controversial. Maybe we should only be using the ones that are the most specific, and maybe we should skip vaccinating at birth for a reason. And reasonable people can agree, like maybe we should just have a precaution that we start looking at it to 6 months, because if a baby's very colicky and is struggling to gain weight, maybe that's a baby you don't want to vaccinate, right? And maybe there's the other thing. So there's an individual, and then like, kids with cancer and leukemias and things like that. Should we be vaccinating them? And patients will ask the doctors, and I'll give them everything, like, but isn't cancer an immune issue? And they're not getting those answers. So we're not also individualizing.
And is there any, in your experience, kind of movement in medicine for a vaccine reform? I mean, you hear this binary, totally anti-vaxxer, or what is your problem? How dare you question any vaccine? It seems like we have these two extremes in the medical community. Is there any movement towards like supporting vaccine reform or analysis of the individual issues?
There is some vaccine reform that we're seeing out there. The challenge is that the authoritating bodies, the CDCs and the American Academy of Pediatrics, they're not leading it, and they are in general fighting it. And there's a ton of medicine. There's a ton of influence from pharmaceutical industry, which wants to sell their product. Now, that doesn't mean they're bad, and it doesn't mean that they're hurting people. It just means that they want to sell their product. And that is a big influencer into it. You're seeing reform come from some states where the states will basically sit back and go, it's up to the parents. And then science says, but parents don't know anything about science. And so it becomes the wrong argument. It becomes about patients' rights.
Right.
It's really not about that. It's about really true transparency in science. We have all sorts of problems, whether it's a new pharmaceutical that comes out and later we find out it had all these bad effects, or it's a new vaccine. The pattern of the pharmaceutical industry has caused a distrust in a reasonable person. And they have to account for that. And you're not, you can have all the TV commercials with, everybody doing sunshine, and then all of a sudden here's the side effect list that makes you sick. Or the pharmaceutical industry can make a commitment to transparency. And if they reform that, then I think you'll see the science community back down about how it's either all or nothing or that.
Yeah, no, I think that, just looking and it's really come up in this era of COVID-19, the online debates, and it is very polarizing because you have people who are not scientists, who aren't even, herbal scientists like myself. They're just jumping right in with what they heard in a YouTube video.
Yeah.
And it's so binary to them. You either have accepted this message or you are wrong. And I have to get out of those conversations, because if your starting point is this bad information, I mean, it's not going to go anywhere good. That's why a background and an education to give you a basis for understanding some of that. And even when you have education, there's so much we don't understand. The top scientists don't understand.
Well, we're not good at this. We're not good at medicine. We're just learning about, for example, genomics. That virus is going to behave differently in every different person. It's a line of code going into a unique system with unique code that's going to have unique effects at different ages, and it's going to have different effects in the summer in Arizona versus the winter in Alaska. Meaning that we're not good at this. We're just scraping the surface of how the body really works. And I think that humility helps people. And for me, the humility helps people from becoming zealots. And we can talk about masks with that. I think that that's a good thing to look at. Masks work. The science is very clear. A lot of times it's done badly. We shouldn't really wear kind of a sock over our face through that same sock for 3 days. It needs to be washed and cleaned, and the medical grade are going to be significantly better. But also, because if you wear it and it's dirty, you can give yourself bacterial infections. It is. So the anti-mask movement talks about these bacterial infections and CO2 buildup, and they're real. But the message isn't stop wearing masks. The message should be change your mask more regularly and do that. Now, also people can feel very claustrophobic with them. And it's very real. And it's because what we've learned is it's not so much the cover, it's that difficult to inhale. What I tell people is they have these, they're kind of that triangle. It's a respirator, really. And it has more of a hole in it. It's much easier to suck air. And they'll have filters. It actually works way better than a mask because it has a little filter in it. There's a Canadian company, O2, something that has one out that's really good and portable. They're kind of harder. They're not like a soft. And you take it, you can change the filters, but it's easier to breathe. It doesn't give you that claustrophobic thing. Some people also, their oxygen saturations will go down. And it's a problem. If you ever remember, Rob, I don't know if you ever took any kind of class where they only wanted you to breathe in and out through your nose, like a Kundalini yoga class or something. Yeah. I was lightheaded. I was not used to it, kind of in one nostril out. I always goof up which one it is.
Like pranayama kind of.
Yeah. And that can be that feeling because your nose is covered in your face that you're not getting in. And your body can figure it out after a while. Otherwise, surgeons would pass out all the time. Right? So body will figure it out. You can learn to breathe. Right. You can bring it through the sides of your mouth. But what we need to do is say, okay, if you're having problems with the mask, if you're desatting, you want to look at one of those small respirator types. It's easier to get air in and do that. Or leave it looser and it's okay to do that. That's okay. You want to breathe out through the mask, but do a few of these and get back in your body a little bit.
Well, and coming from a green approach, being mindful of sustainability, my cousin had posted something about some stats that are coming up about disposable plastics, the masks, the gloves. This is an issue in our society, but, I have had folks tell me they're using like respirators and then they'll spray them with hydrogen peroxide.
I don't like the peroxide. I like the silver ion spray. Now this is where you want the ions. You don't want you want the ions. So the sprays that are more for cuts and scrapes. So those are ions. The particles are what you want internally. And companies, they goof it up. They don't really tell you if they're ions or all that stuff. But the Russians do spray the silver ions inside their masks. Now that adds a potential. It can. We don't know. It can add a potential anti-infective thing. We don't really know how well it works. But I would avoid the peroxides for that, but I would look at the silver ions, just a quick medical tip.
No, that's really good. And I know that you're in favor of the nanocolloidal
internally. Yeah, the ions for the outside, ions outside, the nanoparticles inside.
And then silver proteins probably never, right? That's like a not desirable.
What they're doing, I don't know enough about it, and I'm not ready to just throw it away.
Sure.
For my nonprofit, a company developed a silver nanoparticle, but they use just a little bit of organic sugar. In order to get the ions to particles, you have to add something. Okay, you do. And so some of these companies have been adding protein in order to get it to go from ion to particle. And I haven't been too impressed with their data because you need a lot, silver works great when you have, when you have a lot of small particles, millions and millions of these small nanoparticles, not real big particles, small like 0.4 to 0.8 nanometers, over surface area over 100 and that stuff. And then that way you don't need a lot of it. You want to use as little silver to get there as possible. The silver can build up. And you only use it when you're sick. Sure. The protein folks, there's some really smart nano people that really are interested in the way that it's working. I don't know if anybody's pulled it off yet. The data that I've seen has been bad on the types and sizes of nanoparticles. Sometimes they're very high parts per million when they're doing it. So far I'm unimpressed. But I'll keep watching it. It's a very weird market, silver. There's a zillion of them out there. People make it at home. I think most of it can actually build up. Again, you want nanoparticles on the inside. People will use those little silver wires at home. When you're doing that, you're making the ions. You're not making the particles. So it'll help a little bit, but that's a lot of silver in your body. your body can get rid of most of the silver. At an 11 parts per million, you can do a gallon a day for 20, 30 years and probably never get toxic. But you only want to use it when you're sick. I hear people say, take it every day. No, you don't want to do that. It's like taking any antiviral every day.
Well, and the food movement has now a humic fulvic mineral with a nanocolloidal. So I'll send you some of that. Would love to get your
fulvic stuff's really interesting. Hungary and a few of the former Eastern Bloc countries used to use fulvics for clearing toxic metals out. Mm-hmm. Really interesting, because they had the terrible coal, black skies, and all that. So everybody was loaded with stuff. It's really interesting data, and I know you have a really strong standard on what you put in that group. So that'll be exciting to see.
Well, yeah, thank you. No, I think it's really just interesting because it involves trace minerals too. And I think that is all, we used to tell everyone to filter their water at the health food store. They'd bring in the giant containers, fill those up, and so make sure you put the minerals back in because we took the bad stuff out. But if you were drinking from a mountain stream, you'd be getting over 70, a broad spectrum of natural trace minerals, and you're not getting that when you just purify it. You got to remineralize, and
you do, and this is part of protecting yourself from COVID too. I see people, I only drink distilled water. Oh no, that's dead water. It's dead. There's no life in it. Your body is a collection of minerals. Big bag of water with the collections of minerals and different vitamins and things in it. You want to be constantly replenishing that. So and it's hard to get it from our food now. So it really helps us to get those trace minerals from different sources, from nutritional supplements.
Well, I really appreciate your time today, and I think we'll have to do this again and talk about Peace Possible, because if you had asked me a year ago, if you start doing your podcast again and you have Dr. Decker on, what do you want to grill him about? I really would love to do a whole nother show and delve into your work with Peace Possible.
Thank you. It's going well. The world's sort of on pause now, but we're not. There's more sick people than ever. But you've been wonderfully supportive, and small charities like myself don't get chances like this, like you give us. Building food products and getting me on podcasts, and so we're what the society is going to let us be. And I don't have any interest in chasing down giant corporations for money and going to lunches. And so I'd rather do a podcast with Rob and talk more about what we're actually able to do.
Well, thanks so much. That'll definitely be the next one. And I'll put links to Peace Possible, to your personal webpage, and your phone number. We're going to put your phone number because as you were so generously offering, you do a free 15-minute consultation with folks if they call in and schedule it with your staff.
Yeah.
And you assume you also do phone consultations like you do?
I do. And things like COVID, because sometimes they'll have a really good quality health food store right there. And so I can get them on for 5-10 minutes and go, here's what I would go get, boom, 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 or I can ship them packages overnight. And then a lot of heart disease, because heart disease, a lot of times it's just education, and I can work through the medications and, get the reductions whenever possible. But anytime. And I have a busy practice. We'll get to everybody. Don't worry about it. Might take you a week or so, but we'll get to everybody.
You might have to add another day back in, like as you said there, with everything that's. I know. But thank you so much, and thanks for all you do, and we'll talk again soon.
My honor.